Hi, I'm Gary White for Central Kentucky Television. I'm here with Dr. Trish Ciccone at Central Kentucky Optometric Associates, and the month of April is Dry Eye Awareness and Prevention Month, correct?
Yes.
So we're going to talk a little bit about exactly what dry eye is, because it is actually a disease, correct?
Yes, it is. Dry eye is a disease, and Central Kentucky Optometric Associates is now an accredited dry eye center. So we take dry eye very seriously here, and while some people think that dry eyes are just an annoyance, for some people dry eye can be a very debilitating disorder, and chronic dry eye can cause permanent changes to your tear or to your eyelids and to your tear production, and cause permanent changes and damage to your vision. So dry eye is a serious disease, and it is a disease, and that's one thing we want folks to really understand. One of the neatest things and newest developments in dry eye is that we now have an objective way clinically in the office to actually measure whether someone has a dry eye or not. And so it helps us to differentiate whether someone's symptoms are actually dry eye symptoms or whether they might be related to another condition. So, and we can actually quantify the dry eye as being mild, severe, mild, moderate, or severe, and hence we can alter our treatment depending on the results of this test. So.
And the test can actually be done here in the office, and it's rather unobtrusive, is that correct?
Yes, it is. It's a very easy test to do. It's probably one of the easiest tests that we do in the office. And we implemented this test in the office in December of 2013. So we've been using it for about 3 months now. And I must say that it's been very, very successful in helping us diagnose more accurately those folks who are truly suffering from dry eye as opposed to other issues that can cause dry eye. And it really helps us to determine a treatment plan for patients also.
Well, as we know, as we said, it's April, and now a lot of allergies for people are kicking in. So some people might be thinking that their dry eye is strictly an allergy situation. But really, it can be allergies, but it also could be an actual disease that's leading to this problem.
And the tear lab, again, will help us to determine that. The tear lab measures your tear osmolarity, and it marks certain biomarkers in your tears, and it detects those that are specific for dry eye. So we can determine whether or not your symptoms are strictly allergy, whether they're more leaning towards a dry eye issue, or sometimes you can have a combination of both. Something that folks don't really understand a lot with dry eye too is that often when someone's eye is dry, it will water a lot, and they think, how can my eye be dry? It waters all the time. And that's actually a symptom and a side effect, and it has to do with the innervation loop. It gets kind of complicated, but what your eye is trying to do is it's trying to overwork, and it signals your accessory lacrimal gland to produce more tears. Those tears don't lubricate your eye really well. Those are more of your emotional tears, but it's kind of a backup plan, and that's what causes your eye to water when it's dry.
Now, who are most likely to suffer from dry eye?
Anybody can suffer from dry eye. It can be physiological as opposed related to often autoimmune disease, things like arthritis, lupus, polymalacia rheumatica, any kind of autoimmune disease. It has a higher thyroid disease, that's another one, diabetes. Any of those can result in producing a dry eye for somebody. It can be environmental. You might work in a very dry environment, or you might work outside, so it could be environmental factors, or it could be related to a medication that you're taking also. So dry eye, the causes of dry eye are multifactorial. One of the most common underlying causes of dry eye is called blepharitis, which is actually inflammation of your eyelid. And there are several different causes of that. So it's really, really, really complicated sometimes diagnosing the cause of dry eye.
But there are treatments.
Oh, there are a lot of treatments. Sometimes we'll treat with just an artificial tear supplement. Sometimes treating the lid disease cures the dry eye. Sometimes altering medications or trying different medications for folks whose medication is causing the problem. Sometimes we'll use little plugs to put in your tear duct to help block the drainage of your tears. We'll use anti-inflammatory drops sometimes to help reduce the inflammation associated with dry eye. So yes, there are many treatments, and depending on what your particular cause of the treatment or the cause of your dry eye will alter and dictate which way we go as far as the treatment goes.
But the first step is to contact Central Kentucky Optometric Associates and set up an appointment to have their test done.
Yes, we can incorporate the test and do it if you're coming in for a routine exam. The girls, my staff is trained to do a screening questionnaire to determine whether or not you have the symptoms that the test would be medically appropriate for us to perform. Or you can just come in if that's your problem and you've already had an exam for the year and just need dry eye testing. We can just do dry eye testing for you too. It's covered by most insurance plans. There's some that still consider the test somewhat investigational, so there's a few insurance companies that are kind of dragging a little bit on paying it, but it is reimbursable by most insurance companies, and it's not expensive, $25 an eye. It's not expensive.
Great. Again, I'm talking with Dr. Ciccone with Central Kentucky Optometric Associates. April is Dry Eye Awareness and Prevention Month. This has been Eye Care News on Central Kentucky Television. Contact Central Kentucky Optometric Associates in either Lebanon or Springfield and set up an appointment.
Yes. The dry eye testing is done in the Lebanon office, so if you want that specifically, then come on over here to the Lebanon office.
Great.
Okay.
Thank you very much.
All righty.
All right, this is
Thank
Gary
you.
White for Central Kentucky Television.